Hi all, I'm Dr. Malati, working as a professor in Tripoli College of Nursing. So in this video, I'm going to discuss about the Cordocentesis. The objectives are introduction, definition, indication, time period, pre-procedure, procedure, post-procedure, risk and complication, summary and conclusion. Introduction. Cardosynthesis, or otherwise known as percutaneous umbilical blood sampling. It is an invasive prenatal procedure. Usually it is done to identify any abnormalities which has been developed in the fetus. So for this procedure will be used to obtain the fetal blood from the umbilical cord under the guidance of USG, usually after 18 weeks of pregnancy. It helps in diagnosing the fetal disorders such as anemia, infection and genetic conditions, and can also be used for treatment like fetal blood transfusion. Definition. As I told you earlier, it is otherwise known as percutaneous umbilical blood sampling. It is a diagnostic prenatal test in which a sample of the fetal blood is removed from the umbilical cord for testing the photosynthesis, which is usually done after week 18 of pregnancy. Can be used to detect certain genetic disorders, blood conditions, and also certain infections. So cardosynthesis can also be used to deliver the blood and medication to a fetus through the umbilical cord. The uses of cardosynthesis is becoming rare because diagnostic procedures such as amniosynthesis and chorionic villi sampling, which pose a lower risk of fetal death, can be used instead for prenatal diagnosis of diseases. So, cardosynthesis is most often done to test for anemia in the baby. Indications. Indications are rapid karyotyping, helps to diagnose the chromosomal abnormalities, anemia, testing and treating the fetal hemolytic disease, infection screening, evaluating the fetal infections, example toxoplasmosis and rubella, fetal medicine, delivering any medications or blood transfusions directly to the fetus. So these are the indications for cardosynthesis. Time period. This procedure can be performed at 17th week, anytime after the 17th week of pregnancy. Usually this procedure is done between 18th to 20th week of gestation, but ideally we can do it after 17th week of gestational age. Pre-procedure which is supposed to be done before we start the cardosynthesis. First thing is counseling. Counseling, which is nothing but you will be explaining the complete procedure, purposes, and what may be the risk or complications may develop after this procedure. And make sure getting a consent, informed consent and sign from the mother. Preparation has to be done like checking the vital signs and prepare the ultrasound machine. Skin preparation also has to be done. Then review the fetal ultrasound to ensure the viability of the fetus and the location of the fetus. So about 30 to 60 minutes before the procedure, the client may be given an antibiotics to reduce the risk of uterine infection. This is usually done through a tube inserted into the vein. So the vein, which is why we are selecting the vein for this procedure, larger in size than the umbilical arteries, and also it causes the less fetal bradycardia and it reduces the risk of hemorrhage. So that is the reason we are selecting the umbilical vein for the procedure. Coming on to the procedure, a 22 gauge spinal needle, which is 13 centimeter in length, is inserted to the maternal abdominal and uterine wall under the real-time color Doppler ultrasound guidance using the curvilinear probe. So the needle tip is progressed carefully and it punches the exact point of the umbilical vein, approximately 1 to 2 centimeter from the placental insertion. So around 0.5 to 2 ml of fetal blood is collected. So it is performed under local anesthesia, usually from 18th week of gestation. Post-procedure. The post-procedure or monitor the fetal heart rate for next 30 to 60 minutes, observe for any vaginal bleeding or any amniotic fluid leakage, assess for any maternal signs of infections in the form of mother has developing any fever. Then you educate the mother or else advise the mother regarding the monitoring for signs of labor pain or infection at home. Then, if a woman is having an RH negative, then we are supposed to administer anti-D immunoglobulin 100 microgram IM should be given. This is the image of a cardosynthesis. The risk and complication after the procedure are, first and foremost is miscarriage. So here it is approximately 1 to 2%, which is higher than the amniocentesis, that is 0.1 to 0.3% higher than the amniocentesis. Then fetal bradycardia, amniotic fluid leakage, preterm labor, infection, intrauterine death, and overall fetal loss will be 1 to 2%. So these things may also due to bleeding, hard hematoma formation, sepsis, fetal-maternal hemorrhage, or premature rupture of membranes. Summary: cardosynthesis is an invasive prenatal diagnostic procedure used to obtain fetal blood directly from the umbilical cord. It is mainly performed after 18 weeks of gestational age to detect the conditions such as fetal anemia, infection and genetic disorder, and may also be used for therapeutic purposes like intrauterine transfusion. Conclusion: it is a valuable tool in advanced prenatal care, providing the accurate and rapid diagnosis. However, due to its associated risk, it is used only when essential and when the benefits outweigh the potential complications. References. Thank you.